Check out this episode of Cutting Edge Health, Preventing Cognitive Decline.
As we now said, okay, the research is actually pointing us in a new direction. Then you've got the group there that's sitting, the peers who are sitting there saying, well, we don't want that new direction. We want to stick with where we're going here. So it's unfortunate. And I think this is the history of medicine. You look at what happened with scurvy. Very interesting. 16th century, 17th century, 18th century, 19th century. Every century you would see someone would come up with, oh, wait a minute, we need to we need to understand this disease. We can do better. That was the whole limeys, citrus fruit, this can help. And then the doctors would say, no, that's not the way it works. And so it would be lost for a while again, and then it would be brought up again. So it took a long time for doctors to change their approach. And you go back to Dr. Semmelweis, who was the one who said, look, when women are dying, when they give childbirth, when they give birth to children, to babies, because we're not keeping our hands clean. And people said, no, you're crazy. There's nothing. One expert at the time, this is the early 1800s, said, there's no way you can get enough stuff under your fingernails to kill a whole human being. That's silly, because they didn't understand what germs were there. So this guy was ultimately forced into an insane asylum where he died within a couple of weeks, ironically, from an infection. And so, this is the history of medicine. It hasn't been about disruption the way Silicon Valley has been. It's been about tradition and permission. And of course, it's worse than ever now because people have to ask permission from their insurance agencies. Am I allowed to give this treatment? Am I allowed to give that treatment? It's hilarious. So yes, medicine is, leading us back into the 19th century. It's really, really out of date. And 21st century medicine needs to change fundamentally the way we think about healthcare and the way we deliver healthcare.
I bet sometimes you feel like one of those guys from the past. You've been up on the mountaintop kind of by yourself and received a lot of criticism because you were the first rabbit out of the hole with something that worked and it was different. And so I bet I bet it's been hard sometimes.
I have to say, the science part was the fun part, the interesting part, the intriguing part. The activism, and I never signed up to be an activist, but to be able to get out there and say, look, this is what the data actually, look, these people are actually getting better and the people in these drug trials are not. As you said, we've had a tremendous amount of criticism, marginalization. We've had getting invited to be on various shows and then canceled. I had an invitation to be on the Today Show, which was then summarily canceled when the Alzheimer's Association went on before.